Yes. Hello and welcome to Seven Continents. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions for the nurses and we have Neethu Sajikumar from Idukki, Kerala, India. Yes, Neethu, you can start now.
Good afternoon.
Good afternoon, nurse.
My name is Neethu Sajikumar and I am one of the registered nurses working in this medical clinic. Mr. Johnson, I'm here to discuss with you more regarding your medication changes. As per your GP's order, your blood report showed that there is little bit elevation on your blood sugar level. So the doctor has decided to change your oral medications to insulin injection. So are you aware about that?
Actually, nurse, I'm managing well with my diabetes diet, medication regimen, and exercise program. Everything is going on fine. Then why does the doctor want to change my treatment plan suddenly? Is there any particular reason for that?
Mr. Johnson, what you said is correct. I know that you are taking proper diet, but the thing is that your oral tablets that you are taking for lowering your blood sugar is not adequate. It is not controlling your blood sugar level. So it is very mandatory to start with the insulin injection at this situation. So I can assure you that after some time, once your blood sugar level get lowered, that time we can restart oral tablet. So how does that sound?
Yeah, that's very nice, nurse. But actually speaking, I am unsure about starting insulin injections because, I just really do not like the thought of injecting myself. I don't think I can manage all by myself. It's very difficult, nurse, because I'm scared of these injections and all.
Mhm. Yes, Mr. Johnson, I do understand your situation. I know it's quite frustrating for you to start with insulin injection, but I can make you more clear about this injection insulin, and as well as I can demonstrate to you after our discussion. Okay, so after hearing this all things, you may get some idea regarding insulin injection. And the fact is that there is nothing to be scared of from this insulin injection. It is very simple process because so many people are taking the insulin injection by themselves. So I can assure you that you can also do this insulin injection by yourself. Okay.
Yes, nurse. And why don't you suggest me some other way to manage my diabetes? Is there no other option available?
Mr. Johnson, I already informed you that your blood sugar level is very high. So at this moment, it is very important to start the insulin injection. If it is not started, means it will lead to some other complications. Okay, so preventing this all complication, the doctor is suggesting you to start with this insulin injection. So I already mentioned you that after some time we can switch off this medication like oral tablet. So is that okay for you?
Fine, I understand. The information is very clear. The message is understood. So I feel, better about the injections now. Come on, tell me, nurse. Tell me what I have to do and what is the procedure, and explain me everything related because this concerns my health.
Yes, Mr. Johnson, I can explain you each and everything regarding the insulin injection. Okay, so let me tell you more regarding the insulin injection process. Okay, the first thing is that before the procedure, make sure that you wash your hand with the soap and water or any hand wash. After that, it is make sure that you should clean the site that provide a sterile feel, and make sure that you can select the desired dose that all we will discuss. We will inform you regarding the desired dose, and make sure that you insert the needle on 45 to 90-degree angle. So and you can wait for 15 minutes. After the procedure, once the procedure is completed, please make sure that you not rotate the side, because there is high chance of getting some lump, and that will lead to some other complications like redness and all. So preventing this, it is good that to avoid rotating the site after the insulin injection. Is that clear, Mr. Johnson?
Yeah, of course, of course.
Yes, one more thing I would like to inform you is that make sure that after the insulin injection, the used needles please discard on the suitable containers. Okay, that we will provide one container to you. So please make sure that you put the used needles on the container. That will make you safe and also that help for the proper handling of the needles. Okay. Am I making myself clear to you, Mr. Johnson?
Yes, nurse.
Okay. And please store the insulin on the refrigerator so that there is a high chance of some chance of getting some issues with the mishandling of the insulin. So make sure that you keep the insulin on the refrigerator. Okay. Are you clear with everything?
Yes, nurse, I understand what you have explained. And okay, fine. Tell me, what should I do after taking these injections with these syringes and needles?
Yes, Mr. Johnson. As I said, I already informed you that after the injection, you please discard the needle on the container and you please make and keep it on the safe side so that we can avoid all unnecessary prick from the user needles. Okay, and make sure that you change the needles every day and no need to worry regarding the insulin injection more because everyone is doing this by themselves. Okay, and for you I can give one brochure also, so you can go through that brochure on your free time and you may get aware get more aware regarding this. Okay, so now I will demonstrate you. Okay.
Yes, nurse.
Okay, Mr. Johnson, do you have any more concerns?
Yes, of course, of course. Everything is clear. I have no doubt regarding anything. So I'm really, really happy. You have taken your time and a lot of patience you have. Thank you once again, nurse.
Okay, Mr. Johnson, thank you. Thank you for listening me. Now I will demonstrate you. Okay, thank you.
Yes, nurse. Okay. So can I give you some constructive criticism, Neethu, Sajikumar?
Yes, sir.
Will you take them positively?
Yes.
Okay, fine, fine. Now let me tell you, Neethu Sajikumar, it was a good, very good, better, lot better presentation than the earlier ones. You have come very confidently because when I was taking on the audio, you were doing little upset and panic. But now online itself, live, you are very much attentive and improved a lot. I can say I really appreciate. There's a lot of. I think when in the real scenarios you are. Maintaining that accuracy more. That is what I can tell you. Instead of audio here, direct live. It's really, you did a wonderful session today, and fluency is maintained well. There's no problem with your fluency, but one problem with you is you have said that I want to tell you that this is that, then there is that, like that you have used the word almost a dozen times or even more than that. You can check it on. Okay, and avoid that, as totally eliminate that from your sentences. Totally eliminate. I don't want to hear that, because when you start using that, you'll use again and again the same thing. So avoid that from your speaking. Don't remember the word that. Try to forget. Otherwise, it will be troubling you a lot. Then next one, you said at this situation, not at this situation, in this situation. In this situation, not at. Okay, in this situation. Then you said, I can make you more clear. There is nothing called more clear. Clearer, clear, clearer, clearest. There is nothing called clear, more clear, most clear. No, clear, clearer, clearest. So you can say clearer. I will make it clear for you. Okay, you can say like that. I can make you more clear. What do you mean by I can make you more clear? So people cannot understand me, or what? You can make me more clear means what? The sense is not understood. I can make you more clear. There is no meaning. Instead, I will definitely explain the procedure for your for your better understanding. Write down. I will definitely explain the procedure. I will definitely explain the procedure so that you can have a clear idea or understanding or clarity on the subject. Like that you can say. Is that clear now?
Yes, sir.
So next one is pronunciation. I don't think you have any problem with pronunciation. Earlier, I think you were little, hesitated. You hesitated a little bit and you took some pauses and breaks. But now today, I don't think that there is some problem with your pronunciation. You're doing very well, and the fluency is maintained well throughout. Avoid repetition, number one, and try not to use ordinary sentences. Use better sentences. Try to make 2 or 3 sentences and join those sentences using conjunctions, linkers, markers, pointers, okay, sequencers. These are all things. Okay, first you have to take this injection, then remove the plastic wrapper, then you can fix the needle to the syringe, then afterwards, no, like that one. First, next, then, later, finally, or first, second, third, fourth, fifth. Firstly, secondly, thirdly, fourth. Like that also you can use. So because you're speaking to a patient, in doctor's writing you don't need, but here you can use all these things. And then you can say passive voice instead of. So no need. I will explain you the procedure. The procedure will be explained. Why do you want to tell I will explain you? I will explain you the procedure. The procedure is important. Procedure forward and say the procedure will be explained. Is that clear, Neethu?
Yes, sir.
So I'm telling you, see how much you implement, okay? How much you implement, you can implement. Then next one is regarding your style. Okay, no need to repeat the name of the patient, Johnson, again and again. Then the confidence level is good. I cannot say very excellent, but it's better than before. Then next one is your vocabulary. Try to improve your vocabulary. Use C1, C2 vocabulary. I have put a lot of C1, C2 vocabulary in the Telegram channel, or you can download. You can ask me, I'll send you a book. Okay, there, you will write there C2 vocabulary and you'll PDF. You'll get in the internet C2 vocabulary PDF. Just type C2 vocabulary PDF and you can get a lot of information from there. And you can use those words for advancing your skills. The next one is grammar. Yeah, you have to work on your grammar because grammatically you're not very strong. You're not weak, but you're strong. You're not weak, you're strong, but you have to become stronger, strongest. Okay.
Okay.
So, is that clear? What did you learn today?
Yes, sir. I have some grammatical error. I must use C2 vocabulary. And I have some, I am using some mistake like more clear. You said that not use that word, more clear.
Yeah, it's grammatical error.
And I am repeating patient name Johnson. I am repeat that. And I have to improve the vocabulary also.
Yeah, of course. That's very nice. Thank you very much.
Thank you.